Okay, so I did a podcast on early periods, and the next one I wanted to do was dysmenorrhea or painful periods. This one I feel like is more of the catch-all. I think it's what people are thinking of when they say, oh, I have a menstrual condition or a menstrual irregularity or something like that. They're thinking of pain. So I wanted to go through this in terms of traditional Chinese medicine. I'm a licensed acupuncturist, so that's the lens I'm looking at this through. There are also obviously Western causes and treatments. There might be some of that sprinkled in, but mostly we're going over it from a more traditional perspective. I think it's helpful to know these terms and kind of have some exposure to them before you go see someone that is not speaking at you through a Western lens. So it's easier to advocate for yourself if you know kind of what they're talking about. If you go to see an acupuncturist or anyone else that would use these sort of patterns or terms. So the definition is menstrual pain that occurs either before, after, or during a period. It doesn't have to be debilitating, but it can be. So it's anywhere on the spectrum of pain. There are patterns that exist within your body that you may not even know that you have. Explaining some of these with other symptoms that are not just pain might be helpful. So in terms of causes, I think all menstrual conditions in traditional Chinese medicine do have kind of these through lines of potential causes. So it's less helpful, I think, to go through those because they're pretty general, pretty broad. I did go over them in my other podcast episode about early periods, so there are some in there, but something like emotional strain, right, or tension or anger or resentment that has been long-standing in TCM, that can be a causative factor for something like dysmenorrhea. It can also be a causative factor for something like amenorrhea, where you're not having a period at all. So it is less specific and less diagnostic to have that information. So I'm gonna leave that so we can kind of cut through to more, specific things right away. That being said, I will say that in terms of painful periods, there is usually some form of stagnation. So we can go over all the different patterns. These are not exhaustive, but they are the most commonly seen. It is good to keep in mind, though, that usually these patterns are in and of itself stagnation or are causative for stagnation. So first, we have stagnation of qi. So this can manifest with lower abdominal pain during the period. It can also be before the period, and a pronounced feeling of distension in both your stomach and in your breasts. It can also be in your rib cage area where you just feel like you can't really take a full breath. There can also be a hesitant start to the period, and the menstrual blood can be dark with or without clots. And you might also have the classic signs of PMS, such as irritability, mood swings, and then maybe also some form of appetite, either it's increased or decreased changes. So the tongue would be either normal colored or maybe slightly red. And I went into tongue impulses in the other one. I don't know if it's really that helpful because they change so easily, and it doesn't have to be one way or the highway. It's not like, okay, if I have a normal colored tongue then I have stagnation of qi. They're not, set in stone that way. So I guess I'll say them based on textbook, patterns, but they can ebb and flow for sure. But the tongue would be either normal colored or maybe slightly red, and then the pulse would be wiry. So wiry is usually what the average person would think of when they think of a pulse. It kind of just feels like a pulse at its basic level. If in case wiry is confusing. And then there can also be a choppy pulse if there is some of that stagnation also causing maybe some blood stagnation. Okay, and then Stasis of blood. This would be more intense pain. Stagnation of chi and stagnation of blood, one way to tell the difference is through the type of pain. So for stasis of blood, you have that more excruciating or intense, doesn't have to be excruciating, more intense, usually stabbing pain. And this can be, again, either before or during the period. The blood of the period will be dark. And then with this one, you'll most likely have clots that are larger. They don't have to be, but they tend to be a little bit bigger. You're also going to have maybe some mental restlessness and then pain relieved after the clots have passed. And that's not always true, but it can be true. The tongue is more on the purpley side, and the pulse, again, can be wiry or choppy. Then we have stagnation of cold. So with this pattern, you're going to have potentially lower abdominal pain, either, again, before or after the period. The pain is more central, and it's relieved by the application of heat. So the menstrual blood here can either be bright red with small clots, or it can also be dark. And sometimes the amount of blood will be scanty in comparison to other patterns. You're also gonna have maybe some feelings of cold throughout the body, maybe what we would call, just with like a Western thinking mind, as poor circulation. When people say, oh, I always have cold hands and feet, that's poor circulation. You could think of that. Also just feeling cold otherwise, like if you're always that person who has to be bundled up. And you might also have a sore back. The tongue here is either, again, purpley, or you can either have like a blue purple, or you can also have pale purple. And the pulse will be choppy and maybe even deep. So you have to press pretty hard to feel it. Okay, and then on the opposite end of the spectrum, you have damp heat. So for this one, you might have pain either before the period or during it. And there will sometimes be a burning sensation in your lower abdominal region at some point within that region. You also could have feelings of heat, whether that is heat almost like a hot flash type feeling where it comes and goes, or you can just feel and run hot all the time. The menstrual blood will be red, more likely in this one, and there will be some clots most likely. There will sometimes be more of a smelly discharge in conjunction with the period. And you can also have dark urine, thirst, and agitation or anxiety feeling, or palpitations, your heart races more easily, you just feel on edge. You might have problems with sleep. Your tongue is going to be red here, and you're probably going to have more of a yellow tongue coating versus no tongue coating at all. There probably will be something there, whether it's thick or not. It probably will have more of a yellowy hue, and the pulse would be more slippery. Now we have a more nuanced version of that, where we have stagnation of liver chi turning into fire. So here we're taking that more basic chi stagnation that we had before, and now this is more chronic and it's turning into what we call fire. So for this one, you might have distending pain in the abdomen. This can either be, again, before or during the period. You're going to have probably darker menstrual blood, but it also can be, red. Heavy periods. So this is a good distinction between cold and heat. If the period is really heavy, more likely it is from heat versus cold. You can also have, again, a burning sensation in some region of your abdomen. Going to have irritability, more anger, more mood swings, first feeling hot, and then also constipation is usually associated with this. Here you're going to have kind of the same tongue where it's red with a yellow coating, but in this one, you can notice that the sides of the tongue are redder than the rest of the tongue. And then the pulse will be more rapid and wiry versus slippery. So it can be slippery as well, but in this one, you might have more of that heat presenting, because now we're talking about heat being the main component versus before with the damp heat, we had damp there. It kind of, depending on the ratio of damp to heat, you can kind of tell that on the pulse. So textbook wise, damp heat would have more of a slippery pulse, whereas stagnation turning into fire would have more of a rapid or wiry pulse. So this fire, so-called fire, is deriving from a long-term stagnation of liver qi. So this is where pattern differentiation becomes so nuanced, and it really is an art and a practice, because textbook-wise they would say to not treat this just with, let's say cold herbs that are going to drain the heat, but instead clearing it through the elimination of the stagnation that caused it in the first place. So there are so many nuanced, detailed questions that are asked of patients, and this is why, because you can differentiate stagnation turning into fire versus like damp heat, let's say, or another type of heat presentation through more nuanced symptoms, and that will help you then treat it more optimally. So, yes. Okay, then we also have qi and blood deficiency. So now we're getting into, those were all excess type patterns. Now we're getting into more deficiency. So in this one, the pain is going to be more dull, and it's going to be most likely in the lower abdomen region. And this time, instead of being before the period, we're now going to see more of this pain after the period. So it can either be during, maybe toward the end of your period, and then also continuing after you have stopped bleeding. There might also be a sort of heavy or dragging sensation in your lower abdominal region, and your pain is relieved by pressure or touching or massage or some sort of warmth that helps the pain go away. Bleeding will most likely be on the minimal side, and you can have tiredness, dizziness, maybe loose stool. You don't have really a desire or motivation to get out of bed or to do a lot of stuff around this time of the month, and your complexion might be on the paler side. The tongue will be, again, also a little pale, and someone with this pattern that is more, it's coming from their constitution, it's what they were born with, let's say. Maybe they're born with maybe this deficiency, or they have a tendency toward it. They might actually have a smaller tongue in general, and the pulse will be either wiry, choppy, or it can also be thready and weak. There's room there with the pulse. A little bit further than that would be yang and blood deficiency. So again, you're going to have that dull abdominal pain that is either at the end of the period or after the period has ended. Again, you're going to have less bleeding throughout the period. And the abdominal pain, again, is relieved by pressure and some sort of application of heat. In this pattern, the heat really helps, and it's a differentiator between something like qi and blood deficiency versus yang deficiency. In both, heat or warmth can feel good, but usually with a yang deficiency, the heat is almost necessary to get through that pain. So it's not the major differentiator, but it can be one way to phrase the question if, how helpful is heat? This person might also have headaches throughout their period or around that time. They might have dry eyes or trouble seeing after, a long day. Maybe their eyes start to hurt, or they get the floaters. They might feel more cold than someone who does not have yang or blood deficiency. And there might be more brain fog here, more of a tendency toward depressive moods. And they might also have dizziness and vertigo. So here the tongue is going to be pale, but The difference between this one and the pattern before it is that this tongue will appear more swollen. The pulse will also be an end deep. Okay, and then finally for this episode, we have kidney and liver yin deficiency. This is a common one that, depending on age, not always, but it is common to see. So for this one, we have dull hypogastric or hypochondriac pain. So anywhere really in the abdomen region, again, you're going to have that dull pain, and this is toward the end or after the period. Here you might have some of that sore and aching low back that comes with your period or is anywhere around that time. It can also happen during ovulation. Here you're also going to have some dizziness, maybe some vertigo. The pain is also relieved by pressure or touch, massage, warmth, and you more than likely will not have a lot of bleeding here. Tinnitus is a big symptom here, blurred vision, and overall exhaustion. You can also have some sort of, I mentioned dizziness, but vertigo spells, like, the room is spinning, especially around this time where you are losing blood. And with this, there's kind of a spectrum of this. So as you move on this spectrum and get deeper into it, you might end up having signs of what we would think in Western terms as menopause. So, heat flashes, random feelings of heat that come up maybe in your hands, your feet, in your chest, in your abdomen, somewhere in your torso, and thirst and agitation, things like that. The tongue here is usually not going to have any sort of coating, and it will be red. It doesn't have to be red, but one of the big differentiators is the coating and whether or not there is one. If there is severe yin deficiency, this is usually in people with chronic illness. So think something like a chronic autoimmune condition. They might actually have what we call ice flow cracks. So it actually looks like maybe a sheet of ice that's kind of been cracked in one area, and you have a flooding of different cracks all over the tongue with zero coat, but that's usually pretty severe. So maybe not with what we're talking about here with dysmenorrhea. It can be, but it doesn't have to be. Really what you're looking for is there a coating or not? And where is the coating if there is one? For the pulse, it will be either more superficial, so you'll feel it with barely any pressure at all, and it will feel weak or thin. Or you can also just have a thin pulse that you can feel at every level. So there's 3 levels there. So that is a quick overview of some of the most commonly seen patterns for dysmenorrhea. And then within that, you have your treatment principles. So how are you going to go about treating this? And then you have some points and some herbal formulas and just general lifestyle recommendations that are given depending on each of those. You can also break those up, each of these patterns, a little bit more or add on other patterns. I rarely diagnose people with a single pattern. It's usually a bunch because we're complex and that just is what it is. Most people, especially by the time they come to me, are pretty far within their struggle, whatever the condition is. It's usually not when it first starts. So yeah, you kind of have to think about how these all work together and what are the nuances once you start piling them on each other, and where should you start now that you have 2, 3, 4, however many patterns. Where do you start? And then kind of go from there. Textbook wise, they say that the more deficient types are quote unquote easier to treat than the excess types. And it's said that the damp heat pattern is one of the most difficult to treat. This is due mostly to the fact that you have dampness and heat, so you have to clear both. And it's deciding, are we going to do that together or separately, and which one is more important to go first. There also is this idea that treating stagnation or more excess patterns the 2 weeks before a period, and then treating deficiency or more deficient patterns the 2 weeks after a period is a good way to go, and that can be true as well. There really is like a mixture of what is the pattern or patterns, where do you start within that, and then when during the cycle should you be carrying out each phase of that treatment. So it's hard to even get all of this in one episode or one podcast or one post, one anything really, but high level, you can think of it that way. If you have pain before a period, it is more likely due to a excess pattern versus if you have the pain maybe toward the end or after a period, then it's more deficiency pattern. So thankfully there are more high level, like catch-all, maybe this happens for most people sort of ideals. And that does help quickly diagnose and kind of get your footing with patients, but it's not always the case. So it's good to kind of have it all laid out and be like, okay, maybe this is where we're at. And then you can kind of go deeper from there once you have your footing in front of you. So just some general tips. Ginger and moxa on your stomach is known to help decrease the pain from dysmenorrhea. So this is where we put a literal piece of ginger on the stomach and then put that herb IA on top as the moxa. And you burn this herb on top of that, and it can help warm up the stomach area. There also is research to suggest that acupuncture can help reduce prostaglandin levels in menstruation. And there are a couple points on the stomach that also are known to help with reducing pain from periods. There are some ear points as well, such as Shenmen, the uterus point, endocrine point, the subcortex point, sympathetic and kidney points on the ear that are also helpful. And then there's some research to suggest that superficial needling plus e-stim on spleen 6 is helpful for reducing pain. So to close with just some high-level thoughts, if you have menstrual pain, cramps, whatever, that are more before the period, 1 to 2 days before, you would call that a excess condition. If you have menstrual cramps or pain that are throughout the period, not necessarily before or after, you can call that more of a deficiency plus excess condition. There might be more going on there in terms of their interplay between each other, because one can cause the other and the other can cause that one. So that might be a little bit more complex, maybe. Then you have menstrual cramps or pain that are toward the end of the period / are just after the period has ended. This would be categorized as more of a deficiency condition. And usually the pain there is less intense than it would be for an excess condition. So you can see that there are a lot of maybes, a lot of what ifs, and that is annoying, but it's also so rewarding when you do work with an acupuncturist, and vice versa for me when I work with a patient. To get it right is really fun and really rewarding, and it's really cool to use your brain for every single patient and not just solely rely on what has worked in the past. It's good to have that as a groundwork. It does help you lay a foundation with a patient who maybe is suffering from something that is really complex. You at least have a footing to go into that appointment with the patient, and for them, they feel like, okay, at least you have some North Star for where we can go here. But then to be able to look at a patient as a singular entity for that condition, whatever it is, and say to them, there is something here that is not necessarily true for everyone else. Let's figure that out, and then let's relieve you of that, is pretty cool. And I think it really is the future of how we should be thinking about conditions. It's not everyone that has endometriosis, reveals it the same way. Their body doesn't react the same way, and you have to be able to adapt to how that person is with that condition. There's also so much that goes into it in terms of their mindset with the condition, their lifestyle, and how it manifests in their body. Not every body will react to a condition the same way. So yes, that is it. And hopefully I will do more of these. I'm not sure like which ones are more popular in terms of menstrual conditions. We could do like maybe regular ones or heavy ones, minimal bleeding, stuff like that. But yeah, that's that. And I hope you enjoyed.